Everyone, welcome once again to the Center's 2016 Health Policy Seminar Series. My name is Gwen Driscoll. I am the Director of Communications here at the Center. Please forgive me, I have a little cold today, but I will do my best. So it's my pleasure to welcome you once again and to introduce the speakers for today's topic, which is how can hundreds of thousands of Angelenos be protected from secondhand smoke in Los Angeles apartment buildings. But first, and as always, a brief announcement about next month's seminar. Please save the date of May 19th, that's a Thursday, for a discussion of a very timely and very controversial subject. In late 2015, California passed the End of Life Options Act, AB 15, which allows residents to end their life through physician aid, what's called physician aid in dying, or AID. In July of 2016, implementation of the law will begin. In June of 2016, implementation of the law will begin. So this June. Yet there is little guidance on as to how aid will be implemented in the state. Drawing from lessons learned in other states that have already passed aid in dying laws, Cindy Kane, a Center faculty associate, and the author of an upcoming study on aid in dying, will discuss the ethical and practical concerns of AB 15 and outline solutions that may help California policymakers, physicians, and health workers, as well as families, sensitively and comprehensively respond to constituents and patients. This is new legislation on a controversial topic, and as such, the study and this seminar are critical resources for all who are seeking to understand how best to address the challenges facing the severely ill and their families. As for today's seminar, we will, as always, be recording it, and it will be placed on our website at the address you see at the top of this slide. If you would like copies of today's presentation slides emailed to you, please email me at gdriscoll@ucla.edu. Please also note we will have a brief question and answer period at the end of today's seminar that I will moderate. Okay. Without further ado, I'm now pleased to introduce our speakers, Peggy Toy and Ying-Ying Meng. Peggy is the director of the Health Data Program, which is the public service wing of the Center, dedicated to using our research and data to support community efforts to improve health. In this capacity, she oversees the groundbreaking Smokefree Apartments Los Angeles initiative, a center-led grassroots effort to reduce both smoking and exposure to secondhand smoke in apartment buildings in some of the most densely populated and disadvantaged neighborhoods of South Los Angeles. This Smokefree Apartment Los Angeles initiative is part of a national CDC program to encourage voluntary smoke-free policies in private multi-unit rental buildings in the city of Los Angeles and nationwide. And if you've taken a bus or driven around the city of Los Angeles lately, you might have seen some of the results of this campaign, including billboards and bus advertisements encouraging LA tenants and landlords to make smoke-free apartment living happen now. Ying-Ying is the lead evaluator for the Smokefree Apartments Los Angeles initiative and a noted expert on air pollution of all varieties and the problems it causes, including asthma and chronic obstructive pulmonary disease. She's also the lead author of 2 new studies on tenant and landlord attitudes towards secondhand smoke released by the Center last week, and they're available right now on the main page of our website at healthpolicy.ucla.edu. Peggy and Ying-Ying are here to talk to us about the results of the survey, what the project hopes to achieve, and how we can all achieve a healthier and more equitable Los Angeles. Please welcome Peggy Toy and Ying-Ying Meng.
Thank you. Ying-Ying will be presenting our findings, but I do want to give you on the project and the purpose of the surveys. Can we go back to the beginning? Some of those slides are coming up. The Smokefree Los Angeles, Smokefree Apartments Los Angeles is part of the UCLA Smoke-Free Air for Everyone project funded by the Centers for Disease Control REACH program. Just a second here. There we go. So the purpose of the REACH program, which stands for Racial and Ethnic Approaches to Community Health, is to reduce racial and ethnic health disparities and to reduce illnesses and other conditions related to health. Funding opportunity aim is chronic disease prevention, REACH is a 3-year project to build on a body of knowledge that was developed through previous REACH programs. This current project is part of a portfolio of 49 awards, or $35 million in funding to address health conditions throughout the country. This program aims to strengthen capacity and implement evidence and practice-based strategies in racial and ethnic communities. So the UCLA Smoke-Free Air for Everyone project was awarded in September 2014. It's a 3-year, $3 million cooperative agreement to implement a comprehensive action plan. One is to increase smoke-free multi-unit housing in the city of Los Angeles, specifically market rate and affordable privately owned housing. So many people may have heard about the HUD action to adopt smoke-free policies for all of its public housing properties in the country, which is currently under review. But this addresses an area that has not been addressed, which is privately owned market rate housing. The other objective is to increase access to tobacco use cessation, educational and clinical services, and to implement an innovative secondhand smoke exposure screening for all patients in federally qualified health centers in the city of Los Angeles. That's to provide access and information on the dangers of secondhand smoke. Our priority populations are Latino and African American families living in multi-unit housing in the city of Los Angeles. More than half of African Americans and Latinos live in apartment buildings in the city. The estimated reach for this project is over 350,000 unique individuals that is expected to be impacted by these interventions. So this is our target area. This is the city of Los Angeles, but we're specifically targeting the council districts that you see displayed here. Council District 1, 6, 8, 9, 10, 14. As you can see, the 8, 9, and 10, which is the area in which we conducted the surveys that Ying-Ying is going to talk about, is in the downtown and central and south areas of the city, the most densely populated areas of the city, and a high concentration of Latinos and African Americans. So many of you may already be familiar with the health costs of secondhand smoke, but for those of you who are not, nationally, more than 1 in 3 smokers living in multi-unit housing are exposed to secondhand smoke. So even though California has done a great job of reducing tobacco use, nevertheless, one person who is smoking in a building or in a common area can impact all of the units around it and anyone in close proximity to someone who's smoking, and even at a distance, because it can travel through ventilation systems as well as through doorways and windows. Smoking is the leading preventable cause of death in the U.S. and a major public health issue. Secondhand smoke causes 41,000 deaths per year nationwide, and secondhand smoke causes nearly 34,000 premature heart disease deaths and more than 8,000 stroke deaths each year, according to the CDC. Children exposed to secondhand smoke cough and wheeze more and have a harder time getting over colds. They also miss many more school days, and exposure to secondhand smoke impacts cognitive development. In California, the healthcare burden of smoking is high, costing the state nearly $10 billion per year in healthcare costs. So with public housing and other venues being protected against secondhand smoke or restricting tobacco use, it is in the apartment area in multi-unit housing in privately owned buildings in which we have unequal protection. Most people do not live in public housing. Many of them live in market rate apartments and of course in residential homes. But the highest concentration of our target population lives in multi-unit housing. Now, some of the most vulnerable populations exist in these housing, in the apartments in Los Angeles: children, those with chronic health conditions, and the elderly. And like other cities in the county, such as Pasadena, Huntington Park, Santa Monica, Baldwin Park, the city of Los Angeles does not restrict smoking in apartments. In fact, 12 to 13 cities to date have gone smoke-free in the county. Most apartments in the city have no smoke-free policy, and tenants who desire to live in a smoke-free environment are unable to move because of scarcity of housing, which means that they really have no option but to try to take action, but moving is a limited option for many of these families. So the tenant and landlord survey was an effort to learn more about tenants' attitudes regarding smoke-free policies, their current experience with exposure to secondhand smoke. Our survey asked these key questions. One is for the tenants: do they prefer to live in a non-smoking section of a building, like in a hotel, which now most hotels are smoke-free, but if they prefer to live in a section that was smoke-free, or would they prefer the building to be entirely smoke-free? What is their experience with secondhand smoke? Did they observe smoking drifting into their home? And do they or another occupant in their home have a medical condition that may be exacerbated by living near smoke? And are there any existing policies in place in the building? We also asked landlords, did they have a policy for their buildings that restricts smoking? If they did, what type of policy did they have? If not, what type of policy would they support? And whether or not they were under rent control. So in implementing the survey, the tenant and landlord survey, we engage our project partners. The UCLA SAFE project is a multi-sector effort that involves not only community-based organizations, the Department of Public Health, local clinics, the Lung Association, Heart Association, American Cancer Society, but it also involves community-based organizations that are working right in the target area, and the Apartment Association of Greater Los Angeles. And so our key partners that serve the council districts that are where the survey was implemented: CD Tech and Fame, where they provide services and programs and actually use residents to actually carry out some of the surveys. They went door to door and interviewed 1,000 tenants, nearly 1,000 tenants this past summer. We also surveyed a sample of the members of the Apartment Association of Greater Los Angeles, as well as other apartment owners. So here is our target area. So as you can see, we were concentrated within the 8, 9, and 10. And our street borders include downtown Los Angeles on the north, on the south Slauson Avenue, on the east Main Street, and on the west Robertson Boulevard, which is fairly far west, but nevertheless has a high concentration of multi-unit housing and a high concentration of Latinos. And now Ying-Ying Meng will share with you our findings and more information about the survey.
Thank you. So as Peggy mentioned, we did a tenant survey. We also did a landlord survey, and what? It's not moving. This one, right?
Right, here it is. You want to go back?
Yeah.
You got it. Okay.
Yeah. So the tenant survey, the instrument was adapted from the LA Department of Public Health Smoking Multi-Unit Housing Survey 2012. And as Peggy mentioned, the staff of CD Tech and the FAME helped with the survey, with the door-to-door survey, and in convenient locations such as car washes and laundromats. And the survey response was recorded in a mini iPad and then stored in the survey analytic platform, and we use that survey analytical platform also did use that for the initial data analysis. So the survey was mainly targeted on the adults and living in multi-unit housing, which means that they live in apartment, condominiums, townhouse, or duplex. If they live in residential motels, hotels, or single-family housing, they are excluded. And the survey was conducted in English and Spanish. So, as Peggy mentioned, the smoke-free policy currently are voluntary for market rate multi-unit housing properties. So 80% of the respondents say they do not, their current housing has no policy, or they are not aware of such a policy in existence. And also the households with children had the same rate of response. And then 68% of the households with someone has chronic condition or living with, or they themselves have a chronic condition, reported that way. Based on the responses, also 16% of the respondents reported currently they are smoking. And this was a little bit high than the state average. And also 17% respondents allowed smoking in their apartment. And but 44% more respondents reported observing the cigarette butts in outdoor walkways, and 35% observed those butts in the parking areas, and then 19% in the hallways. I think. Yeah. In the also, we look at the summer vulnerability characteristic, and people living with children are more likely to report secondhand smoking exposure than those not living with children. And also, households with chronic condition also felt 71% of the households with chronic condition felt secondhand smoking exposure wasn't their house. And also Latino, disproportionately more exposed to secondhand smoking. And the tenants, when there's a secondhand smoking entering into their room, what they do. So 71% attempted by themselves to block the secondhand smoking from entering, and 22% complained to the people who smoke, and 19% reported incident to the property owner or management. The low rate of complaint may show that the landlords are not aware of this problem in their properties. And we also asked the respondents their preference of living in secondhand, in smoking free apartment. 91% believe the smoking, secondhand smoking is harmful to their health, and the majority, more than 80% believe that they prefer living in a non-smoking section or in a non-smoking property. And the people with children and with chronic condition are more likely to prefer living in a non-smoking property. And then even among the people who smoke, over 50% of the people say that they prefer living in non-smoking apartment complex. And surely the people who do not smoke, they have a high rate, over 90% will prefer living in a non-smoking complex. And also then when we ask them whether this policy, smoke-free policy, should apply to the new building, existing building, or both, 95% respondents believe that the policy should apply to all of them. And 85% of respondents who currently smoke also support smoke-free policy in all these buildings. And one thing is that the landlord owner could do is that the prohibit smoking in common area or within the units. And usually it's a little easy to do in common area than in the units. And but when we look at the the preference of in the prohibit smoking in common area versus in units, it seems to be that the support are pretty similar among the for the both. And surely the one thing is that the smokers has a lower percentage of support for within units. And in terms of enforcement, if there's a policy, what the tenants believe the landlord can do, 68% of the respondents believe the owner can require a tenant to move out if there's a violation of existing smoking restriction in the signed lease. And also over 50% of the respondents who currently smoke also think that way. Now we talk about the landlord survey. Aguilar helped us with this landlord survey. It's mainly conducted through the owner seminars and the web-based survey. And again, the data were stored and analyzed using the survey analytics. And this is a preliminary finding just based on the 93 survey we corrected from October 15 to February 2016. And so based on this limited information, that the 63% owners reported they currently do not have a policy, and which represents 85% of the units surveyed. And also 53, more than half of the owner or manager responded that they consider such a policy, but haven't had one yet. And in terms of their preference of restricting smoking in the enclosed common area or in units, including balcony and patios, or both, or just having a designated outdoor smoking area, for tenants, for owners with or without policy, they had a similar level of support for the common enclosed common areas, and also outdoor common areas, and also have a more than 50% of support for the within the units smoking-free policy. And but when we talk about whether they should have some area, some units, or some designated area for smoking-free, then the support decreased. So which really show that the landlord prefer either having a policy for all the area or not. Then if they do not like just having a one area, I think that makes sense because enforcement could be difficult when you have just one designated area or having some units designated as of smoking free. And for those managers or owners who currently have a policy, approximately half restrict smoking in units, and less than half restrict smoking in both units, within the units and in common areas. And based on the survey response, we also see strongly the owners who adopted the policy realized the benefit of such a policy. Their reported reason for voluntarily adopting the smoke-free policy mainly is creating a healthy living environment and improve air quality and lower the maintenance cost. Based on a recent study published in California, it's about like $5,000 per unit if there's a smoked-in housing for the maintenance. And then they also see this as a marketability, the benefits of marketability of the housing, and they also, partially is responding to the complaints from the resident who's currently smoke. And then this graph also shows that the among the owner and with or without policy, they both see the high maintenance costs for smoking units, and also potential liability as identified tobacco smoking as a dangerous substance if they do not have a policy. Oh, also I need to mention that for the owners who currently have policy, they reported this policy did not hinder their ability to fill the vacancy. So that's also good sign. And then why owner do not have a policy? And so we asked that question to the respondents who do not have the policy. 38% say didn't know they could do it, and 35% never thought about it, and 31% thought they were under the rent control, so they were restricted. They may not be able to do it. And then another about third of the respondents say they needed more information. So now Peggy will take over, talk more what we do, because I'm, as an evaluator, I mainly, my role is to observe and comment.
Mostly. Oh, thank you, Ying-Ying. So what the data led us to certain recommendations. One is there is a need to support uniform smoke-free multi-unit housing policies. The fact that landlords do not want to implement the policy partially because of the difficulty of implementing it. So having uniform smoke-free policies is needed. One, we have to protect the most vulnerable populations. Low-income residents, children especially, elderly, pregnant women, and those with chronic conditions and disability. And we need to bring together stakeholders through community-based education. One of the things that really emerged from the data is that, one, a lack of awareness, two, a lack of information about, on how you might go about it. And so creating those stakeholders that are knowledgeable and aware of the value of smoke-free housing and how to implement it was needed. Another recommendation is to support cessation efforts with community-level resources. One of the things that is a challenge is what do you do with people who smoke? Many people who smoke are victims themselves and have little resources to quit or may quit. As you know, smoking takes multiple times to quit. And so having that reinforcement at the local level is needed. One is to encourage the person to not smoke, because one of the difficulties, again, with this population is scarcity of housing means that they don't have an option. So they also need housing, but they cannot smoke in their units and have their secondhand smoke affect others. And then the other is for the owners. There's a great need to educate owners of market rate multi-unit housing in the city of Los Angeles, not only in terms of educating them about what they can do now to implement a smoke-free policy, but most of the apartments in the city of Los Angeles in this area are under rent control, and it has a chilling effect on landlords doing anything about implementing these policies. They're just unsure and unclear. And so one of the things that we are doing is developing a working with the Rent Stabilization Board to develop a guideline for implementing smoke-free policies for rent-stabilized market rate multi-unit housing. So far, the Rent Control Board has not really addressed the issue. And so providing the reports and the data, we're hoping that will lead to a guideline that will inform owners of market rate housing that are under rent control that they can adopt policies and how to go about doing it. And then the other recommendation is to support the implementation and enforcement of smoke-free policies. This is something that at this point has to be done on a voluntary basis. All policy starts with people making up their mind that they are going to implement this action. And our aim is to utilize the information that we have to encourage landlords to implement policies and pursue that action. And then for tenants to understand that they have a right not to be exposed to secondhand smoke, and how they might go about talking with their landlords to implement a policy or encourage them to maybe move them or other actions that will protect them. So this led to the formation of the Smokefree Apartments Los Angeles initiative that Gwen mentioned at the start of the seminar. Utilizing our data and focus groups and working with our core support team of that multi-sector coalition that is supporting this project, we developed this public outreach campaign that launched last week during Public Health Week. It includes billboards, ads on bus shelters, ads will be placed in newspapers, ethnic newspapers in the target area, and the purpose is to heighten awareness and also to provide information where people can go to learn how to go smoke-free by going to the website Smokefree Apartments APTSLA.org, and there's information for tenants, information for landlords, and information on how to quit if you do smoke. We have a partnership with the California Smokers Helpline, who will be working with those that inquire from this area, and we'll be able to track those that are actually accessing that information and provide it to our community partners to share with those residents in the community that want to learn more about how to quit. And finally, acknowledgements. So we definitely want to thank our principal investigator, Steve Wallace, where this project sits in his area here at the center. We also want to thank not only Ying-Ying Meng led this, but we have a great team of folks that were on the evaluation team. Marlene Gomez, our project manager, Terry Kanakri, who is our communications specialist, and the evaluation team, Daniel, Hanaya, Tamana, Raman, and Vanessa Lamb, who just came on board. We also want to thank our partners. I mean, we really couldn't have done this without CD Tech and Fame. Fame actually went smoke-free January 1st, they have a huge complex right in Adams and Crenshaw area where we launched our project. And so we were able to actually talk to tenants who enjoy being in a smoke-free building. CD Tech actually is in the Council District 9, right in the Figueroa corridor. They actually work with a lot of students out of Trade Tech, and those students actually live in the area, so it made it very easy for us to access the tenants and residents. I definitely want to thank the Apartment Association of Greater Los Angeles, who provided access and actually informed the development of the project itself. And Esther Schiller, who's the founder of SAFE, it's a coalition of tobacco control advocates, and the Smoke-Free Registry that's run by SAFE, who contributed to the development and implementation of the surveys. And then, of course, we want to thank Centers for Disease Control and Prevention, who's leading this effort and keeping tobacco control and smoke-free housing in the forefront. They have our survey findings are solely the responsibility of the authors and do not necessarily represent the official views of CDC or the U.S. Department of Health and Human Services. So with that, I think we're going to open it up for questions, Gwen.
Okay. Just get this online. Anyone? I have one.
Can you speak about the generalizability of your findings to other areas of Los Angeles? I noticed that you looked to see whether it was generalizable to the areas that you were focusing on, but can you speak about generalizability? Did you look at that?
Could you repeat the question so that
Yeah.
folks can hear it?
This is regarding the generalizability of the survey results to the larger LA, beyond the LA, beyond our council districts and also the LA County. And I think that in general, this surely our target population is Latino and African Americans, and so we really our survey will concentrate, target on these two priority population, and we do believe it's generalizable to our target population in general. And in terms of the smoking-free policy, I think in LA County there's no same thing. There's no such a policy
For the county.
Right.
But as I mentioned, there are 13 cities, and actually, this survey is unique for the city of Los Angeles, but this methodology actually has been used in other cities, Santa Monica, El Monte. So the first phase is to gather the data, and that is presented to the stakeholders in the community, which has led to the adoption of smoke-free policies in the cities that have gone smoke-free. So, and actually this survey has been used about 10 years now, right? So we modified it for Los Angeles, but it definitely reflects actually findings that have been found in the other cities.
Right. It's comparable with the other survey.
And it was also done statewide by the Lung Association. And again, it also was pretty much in alignment with the results that we saw statewide.
Right.
Any other questions? I have a question. Not to put you on the spot, but 55% of landlords said they would be in support of these policies, but that still leaves 45% of landlords who did not say that. Can you explain a little bit of the hesitation some landlords might be feeling in a bit more depth?
I think it's simply that they really do. Oh, I'm sorry. So that more landlords that were not in support. Understand that this is the beginning of this. These were preliminary findings. 93 landlords that were surveyed so far. And most landlords are simply uncertain. So, they don't know how to go about it. They didn't even, as you saw, one of the results is that they hadn't even thought about it. And many tenants do not go to the landlord, particularly in these communities. And so I think that, but one is that one of the things that landlords have reported is the maintenance costs. And so as they go into a unit where there has been smoking, the maintenance costs are higher. The maintenance cost can be as high as $15,000, but on average it's $5,000 per unit, which is higher than the average maintenance cost of someone who does not smoke in the unit. So I think they're simply not aware. They're not aware of the benefits. There are insurance benefits as well, and that just simply hasn't been communicated. So that's why it became clear from this the survey is that education was needed to make them aware of the benefits and also what they could do. And I think the more that landlords know, this is very much like restaurants. If those of you may have been in California when restaurants went smoke-free, at that time and there was little data available, but restaurants did not. Some restaurants were already smoke-free actually, and but they didn't advertise it because they didn't know if they were going to lose customers. So as the data became available and information became available, more and more people began to, more and more restaurants adopted smoke-free policies. And just like with apartments, so I think one of the things that was revealing is that even people who smoke want to live in a smoke-free apartment. And same thing with dining. People who smoke want to dine in a smoke-free restaurant. So we believe that as the visibility of the benefits are heightened and more people know about it, that there's more education, we believe eventually you will find more and more apartments going smoke-free.
We have a question from online. There are a total of 88 cities in the county of Los Angeles. What is the plan to complete the most important step of research studies? To share the results with recommendations to all cities of LA County. Is there a plan to share the information?
Well, you know, when I'm sorry. So is there a effort to share these findings with the other cities in the county of Los Angeles, the 88 cities in Los Angeles? Well, one thing is that we have our partnership with the Los Angeles County Department of Public Health, that we are making it available to the department, which operates a tobacco control coalition that represents many of the cities in the county. And so we expect that the findings and these reports will be widely disseminated because it will help to support other efforts in other cities.
Right.
Steve?
Would you talk a little more about why rent control is a complication for owners in going smoke-free, or why they think it's a complication?
Well, you know, why is rent control a complication, and why does it have a chilling effect on doing anything to implement a smoke-free policy? You cannot change the terms of a lease in a rent-controlled unit. The only thing that you could do is when somebody moves out, then you can change the lease. So with landlords, with that being the case, they feel they can't do anything about it. But there are things that they can do under rent control. So we talked about SAFE, the Smoke-Free Apartment Registry. I mean, one of the actions they've been taking with landlords is, one, you can talk to the smoker and revise their lease if they're interested in doing that. Some landlords have offered to go in to clean the unit and change the carpets, put in new paint. And that has been successful in some instances to get the smoker to sign off on a new policy. A new lease. The other is that a lot of people who smoke really don't want to smoke and don't want to expose their family members. So they're more amenable to it than you would think. And so, but again, helping landlords to work within the rules of rent control is simply not widely known, and that is one of the reasons why it calls for education.
Did you include all these new modes of smoking in your survey? And comments about the thing, that seems like a lot of people are switching.
Yeah. I think this. The question is that regarding the new modes of smoking were asked during the survey. We didn't specify the detail. We just asked, do you smoke or notice any smoke drifting from other units or outside. And but definitely they are included, like e-cigarette and the marijuana, if people perceive these are smoking behavior.
That's a common question. So, and that is increasing. Marijuana use has been something that has been of concern to property owners. Vaping is also a concern. And the Department of Public Health for California has come out against the vaping and showing the toxic effects from vaping. So our view and our coalition's view, or our community partners, is that smoking is smoking. I do not want to be exposed to your smoke. And my health is affected by your smoke, whether it's marijuana smoke or vaping, and of course we know tobacco smoke. And so it is something that we do address, and it's part of the education effort, but it's not the main focus, but we know it's going to come up, and we do respond and provide them with the reports that help to show the health effects from those other forms of smoking. And medical marijuana comes up frequently, and there are other ways to ingest marijuana besides smoking.
All right, we have an online question. Is there any known free or low-cost federal or state resource that impacted persons can use to test for and measure exposure levels?
Is there an accessible way of testing for exposure levels? So, the technology is still evolving on having an easily accessible means by which to detect exposure, and that's improving. Over the last 10 years, Esther Schiller has been working in this area. There are some researchers, and there has been research that has gone in with very technical, complex equipment to test the exposure levels, but at this time, there's not an easily accessible for anyone, so that I can go, into Home Depot and pick up a monitor that will help me test my exposure. Marlene, you've worked at the Lung Association. Are there any tools?
So the devices that, again, like you're saying, it's still evolving, and many times a lot of the mechanical components that are available measure particulate matter, which is basically dust particles, but as many of you know, smoke comes both in a gas phase and a particulate matter phase. That makes it a little bit more difficult to distinguish whether it's someone smoking or someone cooking something that overburned. But there is something, there are cotinine tests, which can be done either through urine or blood. And cotinine is a biomarker for nicotine, which does allow for that to be an option. The only thing is that the half-life of cotinine is very short, so you would have to get to your doctor with a really short time frame to be able to test that out. And unfortunately, the other challenge is that sometimes people react to very low levels of tobacco smoke. So even though you think you're being exposed to a lot of smoke, when you take this test, the test might not detect that exposure.
You mean the biomarker?
Yeah. The biomarker, yes.
Just because I'm not sure everyone online could hear Marlene, could you summarize a bit of what she said?
Marlene, why don't you come up and repeat some of that?
Could you summarize what is the safe level of exposure?
Oh, there's no safe level of no level.
Yeah. So, however, to address the issue of is there any safe level of exposure, there is none. Even a little bit can make someone sick, and obviously depending on the ability for people to deal with that exposure. I mean, children can react to things that as adults we're not reacting to, for example, or if you have asthma, you might react much quicker and much more drastically than someone that doesn't have asthma or a chronic health condition. Now, with regards again to the available technology towards testing for exposure, I was talking about there are a urine test or blood test that measures cotinine, which is a biomarker for nicotine, and so it's one way you could go to your doctor and get tested for this, but again, there are some challenges that you have to get into the doctor within a pretty short time period after being exposed, and many times, even though you feel you might be exposed to a lot of smoke, it might not show up on these tests.
And that's why we feel it's really important for the secondhand smoke screening. It's a true innovation. It's not currently done. Most of the clinics will screen for tobacco use. But no one is screening for secondhand smoke exposure. Now, some of the clinics, like St. John's Wellness Center in Los Angeles, has an environmental health program, and they have worked with housing advocates to improve exposure to toxins and other health risks within the apartments that's in close proximity to the clinic. So we want to engage clinics to actually screen for secondhand smoke and provide a prescription that will help to protect their health, and presenting that prescription to their landlord that will enable them hopefully to take action. Again, it would be voluntary, but would provide further reasons of why that they need to be accommodated, like moving away from the smoker, or actually encouraging the landlord to go smoke free.
Yeah, and also, like yesterday, Ethan too, she's the faculty at the Department of Environment Health, School of Public Health, UCLA. She mentioned that she currently has a project to measure the particles of e-cigarette. So there's those efforts. I mean, in terms of whether they are all commercially available, that's still maybe a way to go.
Why isn't there an app for that?
Okay, as it is 1 o'clock, and I want to keep people, unless there's another question for the room, I'm just going to end this with a great question for you guys. Do you have any special messages for the vulnerable populations, especially people who are pregnant, with chronic conditions or disabilities? What can they do?
You know, we had a
Repeat question.
I'm sorry, yes. What can people do that are vulnerable? People with chronic health conditions, or pregnant women, or families with children. We're really encouraging them to talk to their landlord. And we are hoping to work with the housing department to actually educate tenants that are in rent-controlled properties in particular, where it's most difficult to implement a smoke-free policy right now. How to talk with your landlord, that you are protected. You're not going to get kicked out by speaking up, and that's a big fear. I think a lot of them do not want to speak up because they have nowhere else to go. And so one is we would encourage everyone to visit our website for this initiative. And I think that we have it up here. Let me see. Oh, it's back. Okay, we'll get it up. So it's Smokefree Apartments LA. Thank you, Marlene. Smokefree Apartments LA. That's spelled aptsla.org. It's on the center's website as well. We really encourage those of you who are working with vulnerable populations to guide them to the website. And there's tools there and steps they can take, very clear, simple resources that they can follow. There's also information there for landlords and, again, for people who want to quit.
And the information will also be available in Spanish shortly for those that, again, for our Spanish-speaking populations as well.
But there's already on the website information available in Spanish, particularly for the tenants. So, again, we encourage folks to visit us and get more information. All right, thank you.
Thank you.